I would like to introduce Dr. Uma Krishnan, who is a cardiologist at the Cardiac Study Center in Tacoma, Washington.
Initially, when I was asked to speak, and this is my first year of talking, I'm like, how am I going to talk for 20 minutes? And then I had to started doing the research. There is so much research that is available currently, and there is a lot of evidence where I think we can conveniently say that prescribing a plant-based, low-fat diet should only help with the other treatments they're already on. When I asked Dr. Rose, he said, you're going to be the first speaker because we know heart disease is the #1 cause of death in the United States, killing more than 787,000 people alone in 2011. So if we look at this, in the United States, someone is having a heart attack every 34 seconds. And when we heard our representative speak, direct and indirect cause of heart disease totaled more than $320 billion. So we need to do something about that. When we talk about heart disease, it just not includes only the coronary artery disease, but also stroke and vascular disease. The other passion I have is about women and heart disease. And heart disease is also the #1 killer of women. And still the research is ongoing, trying to find out what is going to be the best treatment for women with heart disease. And 90% of women have one or more risk factors for developing heart disease. What increases risk? It's going to be age, race, and family, which we cannot change, but where we can make a change is cholesterol, smoking, blood pressure, diabetes, obesity, and physical inactivity. We also know about the prevalence of hypertension and hypercholesterolemia, where it is 30% and 50% in the general population. Question is, why me? Most of us might have a genetic predisposition, but along with that, there is a lot of environmental insults, including urbanization, sudden change in lifestyle, leading to fast foods and other things. When I talk about coronary artery disease, I like to show this little slide showing that we have a normal coronary artery showing blood flow, and then there's plaque starts to build up, and that is what we coin as atherosclerosis, which is hardening of the arteries. And this is just a little slide showing that there could be lipid-filled macrophages and lymphocytes that assemble. And this slide is important because we are going to talk about how plant-based diet can be helpful in improving endothelial function, in helping preventing cholesterol plaque buildup, and how it can also help prevent thrombosis formation. This is where we start as early in the first decade of life. We start to see fatty streaks, and then there is oxidized LDL that starts to make the plaque form. Then there is inflammation, C-reactive protein. All of them can cause the plaques to rupture, cause thrombus formation. By the time they come to the emergency room, they already have had an event or are in need of having surgery. The thing is, we can easily prevent starting very early on in life. Where does cholesterol come from? This is a very important slide. 65% of the cholesterol is the liver. We are genetically predisposed to form our own cholesterol. 35% of the cholesterol is where we can make a major difference depending on the food we eat. And depending on the food we eat, we can also make a difference in how the liver is going to be producing the cholesterol. So one thing here is all foods containing animal fat and meat products are going to be the sources of cholesterol, and plants do not have much or no cholesterol. Question I have here is, we always think this is an aging process, but when do you think cholesterol starts to build? Carl Pepin showed it in American Journal of Cardiology in 1998 that it can start as early as age 2. So it is extremely important where we have to be talking to our children about it, where we can start to make a difference in the fatty streak. By the time they come to see us with the plaque buildup, this is what I'm going to see in an angiogram or in a CTA. This is one where you must have seen outside. Kim Williams is the president of American College of Cardiology. And he made a bold statement. Inspired by one of his patients, he wanted to change the dietary habits and adopt a cholesterol-free, plant-based diet. Dr. Williams writes, wouldn't be laudable goal of the American College of Cardiology to put ourselves out of business with a generation or two by becoming healthy by eating a vegetarian diet. The thing is, we do have enough data, but either they are small and randomized, but we have some large data that is available right now. No matter large or small, research studies have shown strong evidence that vegetarians have lower rates of coronary artery disease, lower LDL cholesterol, lower rates of hypertension, diabetes, and obesity. We all know about forks over knives, and will going vegan or vegetarian reduce the risk of heart disease? So the first slide I have here is from Diet and Coronary Atherosclerosis. This is an article that was published in JAMA in 1960. This was before the era when we had no statins, no stents, or there was no cabbage surgery. Morrison placed 50 patients with confirmed coronary artery disease on a moderately low-fat diet, 25 grams per day vegetarian, and followed them. So he followed 50 patients, followed for 12 years. End of 12 years, 19 of the 50 patients treated with the diet survived, and there was nobody living on the other 50 group. So this, I think, is really a very good study. And we all look at this landmark trial published in Lancet in 1990. This is Dr. Dean Ornish, Program for Reversing Heart Disease. Can lifestyle changes reverse coronary artery disease? His trial was a total of 48 patients. So he had 28 patients in the experimental group, low-fat vegetarian diet. Along with that, they were advised to stop smoking, stress management training, and moderate exercise. 20 were in the control group. He had identified what he did was everybody was put on this diet. They were getting cholesterol checks. They also had an angiogram at the beginning of the test, and then about a year and 5 years later. And overall, 82% of the experimental group patients had an average change towards regression. So if you look at the coronary artery and look at a lesion, they were showing a tendency towards regression. However, in the control group, there was progression. Looking at the results that he got, within a year, he extended his study up to 5 years. And this is what showed up in the 5 years. So 1 year, the diameter of stenosis reduced by 4.5% relative improvement, but the control group had a 5.4% worsening, and the number of anginal episodes reduced to 91%. However, in the control group, there was a 165% increase. We as physicians, we want to know events. Yes, is the cholesterol going to look good? Yes, it's going to look good on paper, but are my patients surviving? Are they staying away from the hospital? Are they not having events? That is the key thing. So when it comes to that, the number of events in 5 years, there was 25 events in the experimental group. The control group had 45. This was a very good landmark study, and still we all know Dr. Dean Ornish has his own program down in California. The other thing was, once you start to look up, so they were able to reproduce this study. So this study was done actually in India. This is Gupta SK, showing regression of coronary atherosclerosis through healthy lifestyle in coronary artery disease patients. This was published just recently in the Indian Heart Journal, 2011. A total of 123 patients were studied. This was also a coronary lesion examination, and 91% of the patients who followed a low-fat vegetarian diet showed a tendency towards regression. And 51%, more than half, showed more than 10 absolute point reduction. And then the other important study that we all refer to is the Esselstyn study. And this was like, the main question was, why are people having events? Is it the cholesterol? So let's get everybody's cholesterol to be 150 milligrams or less. And what else can we do to help prevent events? This was also an angiographic study where he had 22 patients with angiographically documented severe coronary artery disease that was not immediately life-threatening. Patients were taking their cholesterol-lowering drugs, but followed a diet that derived no more than 10% of its calories from fat. And disease progression was measured using coronary angiography, and cholesterol was measured. So basically, the net result was they were followed for a little over 10 years. Definitely there was a reduction in arterial stenosis, and the disease was clinically arrested in the 11 participants, and almost all of them had no new clinical events. He goes on saying, I believe that coronary artery disease is preventable, and that even after it is underway, its progress can be stopped and its insidious effects can be reversed by following a vegetarian healthy lifestyle. This is one of his coronary angiograms that he had on a patient in 1996. This is the distal LAD showing a disease of at least 60-70% progression. And in 99, you can see that the disease has been arrested and to most extent reversed. And this is from Dr. Esselstein's book. Now, when we look at the newer studies, this is a very good landmark study that is available, which is the EPIC Oxford study. So EPIC stands for European Prospective Investigation into Cancer and Nutrition. It showed that vegetarians had a 32% lower risk of developing coronary artery disease. So 1 in every 3rd person that follows can prevent a heart disease, and this is better than any drug trial that we can see. In a drug trial, we are supposed to know number needed to treat. Okay, if I'm going to treat 10 patients for a certain thing, probably I'm going to prevent an event in 1 of them. But here, you treat and you are going to reduce it by 32% lower risk of developing heart disease. And these patients were followed for a total of 11.6 years. And it has a lot of population in it. More than 44,000 men and women were living in England and Scotland were part of the study. And so the conclusion was 32% lower risk of developing heart disease. And one of the thinking is, it's not about LDL cholesterol, it's a lot about non-HDL cholesterol, and systolic blood pressure in this particular study showed a difference. There are like so many trials, I'm just going to elaborate on some of them. A multi-center lifestyle demonstration project showed in heart failure patients, this is going to be helpful. Reduction of angina, because every day when we are in the office, we see patients, and particularly I see a lot of women patients where it is really hard to take control of their symptoms of angina. They have chest pain, they are doing everything right, but this study was able to show when patients, and this study was done in 22 different clinics throughout the United States where they followed a cardiac lifestyle intervention with a low-fat vegetarian diet, 12 weeks, 3 months, they were able to show 74% of the patients were angina-free. This was actually published in the American Journal of Cardiology in 2008. The other thing we always do is coronary perfusion study, where we want to see is the level of ischemia smaller after patients have been on a vegetarian diet along with the standard treatment. And it showed 5 years, patients were studied. We used the positron emission tomography images, a 5.1% decrease in the size and severity of the perfusion abnormality. However, in the controls, there was a 10.3% increase. And so this is what we study as our SPECT imaging or the PET imaging. What is about, why is it good in, that we are able to prevent heart disease or prevent development of heart disease in vegetarian people? So we know oxidized LDL is preferentially taken up by the arterial walls and leads to plaque formation. This has been well studied, published in Circulation in 2002. One study that was published in the Cardiovascular Research, volume 68, showed oxidized LDL a critical factor in atherogenesis. There is evidence that LDL cholesterol in vegetarians is much less oxidizable. The other thing is endothelial function. So other than writing my ABC, which is aspirin, beta blockers, and cholesterol medication, the other thing we usually write is for nitroglycerin. So to help promote nitric oxide. So nitric oxide is essential to vascular health. They won the Nobel Prize in 1998, Dr. Fershot, Ignarro, and Murad, and this was voted the molecule of the year in 1992 by Circulation Journal. Plant-based nutrition has a beneficial effect on endothelial cells responsible for nitric oxide production. So this is found in legumes, beans, soy, and nuts, and L-arginine is the amino acid responsible for nitric oxide production, and the legumes, beans, soys, and nuts are abundant in L-arginine. They help relax blood vessels, prevents platelet aggregation, prevents smooth muscle self-proliferation, all that you saw on the first slide of atherogenesis, and may even help diminish vascular plaques once they are in place. So this is the nitric oxide production. So L-arginine, nitric oxide synthase produces nitric oxide, but most of the animal fat and everything tends to compete for that same pathway. So the more fruits and vegetables, the better. Increasing fruit and vegetable intake increases endothelial nitric oxide in a dose-dependent fashion. The other thing is advanced glycation end products are also another have pathological effects in the atherosclerosis, and we all know that plant-based nutrition has less of AGE products, thereby helping. So this was a new research that showed that the health advantage of a vegan diet, exploring the gut microbia connection. What has been shown recently is vegans have bacterial flora that produce less TMAO, trimethylamine N-oxide, thought to be atherogenic than the flora of meat eaters. So when people follow a vegetarian diet, their gut flora changes so that the chances of them having atherogenesis is going to be less likely. And this is just a busy slide. If anybody is interested, I'm happy to share that with you. And other thing is high antioxidation, thinner IMT. Today, Dr. Fritz was doing IMT measurements along with Dr. Huang. Vegetarians demonstrated a lower blood concentration of C-reactive protein. Long-term vegetarians have a better antioxidant status, and vascular effects of a vegetarian diet includes a thinner carotid IMT. They also have lower blood viscosities because that plays a role when we have to think about thrombus formation, and vegetarians have a better nitroglycerin-induced vasodilation. This is another slide showing fruits and vegetable consumption helps decrease mortality. Mortality from cardiovascular causes was significantly related to less consumption of fruits and vegetables. So you eat more fruits and vegetables, you reduce your risk. Then the other passion I have is about cardiac rehab. So these are patients who already have an event, and how are they going to prevent another event from happening? So this was done by Aldana et al., compared patients in cardiac rehab using either the standard treatment or a low-fat vegetarian treatment. They showed a decrease in anginal frequency, BMI, total cholesterol, glucose, body weight, systolic blood pressure, low-density lipoprotein. So all across, this was a very good study. The other thing we come across that we all know is depression is a concomitant it always, when patients have heart disease, we have to screen them for depression. So that is a big thing that we also try to do in cardiac rehab. There was a study that was done which showed 80% reduction in depression in 12 weeks when patients followed a low-fat vegetarian diet. Improvement was maintained for at least a year after the study was completed. And the other thing we all know is the mortality in vegetarians and non-vegetarians. This was published in American Journal of Clinical Nutrition, 99. 5 prospective studies: Adventist mortality study, health food shoppers, Heidelberg study, Oxford Adventist. 24% reduction in ischemic heart disease when patient followed a vegetarian diet. The other thing is hypertension. I just have a slide on hypertension. DASH1 and DASH2 trials, diet rich in fruits and vegetables. Dairy products with low saturated fat do help with prevention of hypertension and to control hypertension. The Go Red for Women is a main thing from American Heart Association. And Rachel K. Johnson, she is the chair of the American Heart Association's Nutrition Committee and professor of nutrition and medicine, and she endorses the vegetarian diet. She says a woman following a vegetarian diet, research shows that people following vegetarian diets tend to be healthier than meat eaters, healthier weight, lower incidence of heart disease, low blood pressure, and less hypertension. The thing is, heart.org clearly shows less than 1% of the United States adults meets the American Heart Association's definition for healthy diet. So I think we have ways to go. And reducing sodium and increasing whole grains are the biggest challenge. This is the newest guidelines that we would be using. This was published in Cardiology Today, March 2016, hot off the press. And it shows where we can make lifestyle therapies, nutrition and physical activity. And in that, they were clearly stating each 100 milligrams per day of dietary cholesterol will increase the LDL cholesterol by about 1.9 milligrams per deciliter. And we know this is all going to translate into events. Saturated fatty acids, trans fatty acids, mono and polyunsaturated fatty acids affects the atherogenic cholesterol levels. And we all know one egg is going to have close to 200 milligrams of cholesterol, and that is not, that should be avoided. Additional nutritional therapies are the plant stenols and sterols and viscous fibers. So the new guidelines do recommend that you should look into plant stenols and sterols. All the plant foods, vegetable oils, nuts, seeds, and grain products have plant foods. And they have shown that if people can take up to 2 grams a day of plant stenols and sterols, that can help lower LDL. But the typical US diet only provides 200 to 400 milligrams per day. And viscous fiber also helps prevent the binding or helps bind cholesterol and bile acids in the GI tract and thereby prevents cholesterol absorption. And the recommendation is at least 5 to 10 grams per day, up to 25 grams per, can be added up to 25 grams per day. So if we just follow a plant-based vegetarian diet, we can get a 5 to 10% reduction in LDL with following a diet. People will lose their body weight. That will produce a 3 to 5% change in LDL. Add the plant sterols and viscous fiber, another 4 to 10. So the total reduction of LDL cholesterol can be anywhere from 12 to 25% by following a healthy diet. And this is published by Jacobson et al., Journal of Clinical Lipidology, and it is in press. And then the one thing to know is, yeah, our patients would say, yes, I'm trying to exercise, but they keep changing those guidelines on us. Earlier, they said you can exercise 150 minutes per week. Now they changed it. You have to do 200 to 300 minutes per week to achieve the same level of LDL reduction. Vegetarians have a better cardiovascular profile, lower total cholesterol, better ratio, better the lower C-reactive protein. Then the TMOA is less, lower triglycerides, better antioxidant status, type 2 diabetes, which is going to be spoken by my colleague, lower BMI, lower blood pressure. So I think, personally, I believe that this is an advantageous treatment which can be used in combination with the standard treatment regimens, including medications and or interventional therapy if it becomes necessary. This is the American Heart Association plate. I decided we should take out the meat and then start helping replace that with legumes. So I'd like to leave with this quote from Albert Einstein: "Nothing will benefit health and increase the chances for survival of life on earth as the evolution to a vegetarian diet." And further references, but at the end, I really want to say, no matter what we do, keep a positive attitude and wear a smile. It takes only 22 muscles to smile, but 37 to frown. Thank you very much.